So I've really enjoyed EAHAD. It's my first time, and I really enjoyed producing a poster. It did take time. It took some time outside of work, in my own time. I spent time on a weekend or on an evening producing things, but I'm quite passionate about haemophilia, and there's so much in the current practice of haemophilia about all these novel therapies and exciting treatments that we forget to look at the most important aspects of dealing with children and adults with haemophilia. That actually it's about immunisation, it's about school life, it's about the economic and psychosocial burden of families. All of these things are really important to the everyday life, and even with these novel therapies and new treatments, it's still going to be an issue. So to do something I think doing the immunisations was quite an easy subject for me, but actually there's probably lots of other things that people could do. Nurses could choose to cover and do a poster presentation from their own centre, and I think that everyone should at least try. I've been in haemophilia for 4 years, and it became apparent to me that there was further education needed in immunisation practice. It came to a point where I had parents calling me and letting me know their thoughts and feelings on a certain situation where they attended a GP service or they had an immunisation done at school, and they were upset about what happened afterwards. So I thought I'll explore this a bit more. I basically did about 10 questions, which were the process of whether the immunisation was done subcutaneously or intramuscularly. Lots of different other questions, and at the end I had an open-ended question: do you have any other comments that you'd like to share? And with that, I've obviously used that as part of my poster today, just to show people what a lot of parents have felt from taking their child to have a subcutaneous injection, and it wasn't given subcutaneous. There was evidence of good practice where parents felt actually quite reassured with their general practitioner or nurse that was looking after them, or school nurse. But then I also had quite a few responses that were quite negative, that their experience was disappointing, that their child ended up with intramuscular bleeds or hematomas, or that they were disappointed that they had to spend more time explaining why their children need a subcutaneous injection. Part of my recommendations of doing this study was that we need to provide more education to community nurses and school nurses for those people that are administering subcutaneous or immunisations in the community. I think it's really difficult for paediatric patient groups, because a lot of the immunisations for paediatrics are given between the ages of 0 and 12 months, and so it raises a lot of questions about how to manage that, when to give factor if they've already started prophylaxis, whether they haven't started prophylaxis, whether we miss the dose and we give it the next day. And actually a lot of our patients hadn't started any prophylaxis, so we would always only ever recommend a deep subcutaneous route for an immunisation. But obviously there are some other immunisations that are given later on in life as a teenager, and I think it's a general awareness and education that needs to be more of a priority. So what I actually did was use some of the evidence that I had and shared that with the Oxford Vaccine Group. And also we started working on a leaflet. We produced many leaflets, and depending on how fast we can get that approved through the trust, we try and give those out in clinical situations, in clinics, which a lot of parents find very helpful. Gives them a little bit more reassurance as what to expect when they turn up for an appointment at their GP, and they've got some evidence to actually give a practice nurse or GP to say, this is what needs to happen when my child has an immunisation. Please can you follow this guidance, and it will have our contact numbers as well, so if they had any questions they can call us.